Ever get that like sinking feeling? You know when you can't find like that one crucial document?
Oh, yeah.
Like it could be anything, right? A
Yep.
medical record or maybe like a warranty
Uh-huh.
or even something, as simple as the instructions to put together a bookshelf, right?
Yeah.
Yeah.
We've all been there, I'm sure, right? But imagine that frustration, but like 1,000 times worse.
Yeah.
And in industries where documentation isn't just like, oh, this is annoying, this is inconvenient, but it's actually about safety, compliance, and even lives.
Mhm.
And speaking of amazing resources for the world of healthcare and pharmaceuticals, a huge shout out to the London Heartbeats Z Academy for their awesome support. If you are at all fascinated by this world, they have over 140 courses to, kind of boost your knowledge, and follow them on Facebook, Instagram, Spotify, and YouTube for regular updates and more amazing discussions like this one. Trust me, you won't want to miss out. But okay, back to today's deep dive. We are going headfirst into the often overlooked but super fascinating world of documentation and record keeping, especially in those highly regulated industries. To guide us through this maze of details, we have an expert who literally lives and breathes documentation systems.
Happy to be here.
So first off, why is documentation so crucial, especially in the pharmaceutical world?
Well, I think it's really important to remember that every single pill you take, every injection that you get, relies on a mountain of documentation behind the scenes. It's all about ensuring quality and consistency at every step. And it's not just about, like, hoping for the best. You need to be able to prove it to regulatory bodies, to healthcare professionals, and, of course, to you, the consumer.
So it's not just about like having the documents, right?
Oh.
It's about the system.
Absolutely. Accuracy, integrity, availability, legibility. These are the cornerstones of a good, strong, robust documentation system. Every single document needs to be, free from errors, readily available when it's needed, and always, always in writing. No scribbled notes on a napkin here.
Okay, no more napkin notes. But seriously, with so many stages in pharmaceutical production, what kind of documents are we even talking about here?
We're talking about a whole ecosystem of instructions and records. You've got your instructions, like your specifications for starting materials, manufacturing formulas, processing, packaging instructions, protocols for testing, even technical agreements. And then you have the records themselves. So things like certificates of analysis to prove that a batch meets all those quality standards, or reports detailing every step of a process. It's like a meticulously detailed breadcrumb trail. Every action is documented and traceable.
Wow, it's mind-boggling how much is actually documented.
Yeah.
But how do you even begin to manage all of this information?
That's where good documentation practice, or GDP, comes in. It's not just about, like I said, having those documents. It's about how they are created, managed, controlled. Think of it as like the rule book, to make sure your documentation system is both reliable and compliant.
So it's like the difference between having a recipe and actually being able to bake a cake.
Right.
You need that clear set of instructions.
Exactly. EU GMP Chapter 4 actually outlines those principles of GDP, and it's all about that meticulous care at each stage. Documents need to be designed clearly, prepared thoroughly, reviewed very carefully, and distributed properly. They have to be followed, diligently, and they must comply with all registered requirements.
Okay, so no more scribbling notes in the margins. Everything's got to be clear, concise, easy to, double check. But what happens when things change? Like if there's a new process or maybe a regulation is updated?
That's where the regular reviews and updates come in. Good documentation practice, it really stresses how important it is to keep the information current and accurate. Handwritten entries, those are generally avoided. They're prone to errors, and legibility can be an issue.
Yeah, it makes sense. So it's all about minimizing those errors, making sure everyone's literally on the same page, and having a reliable record of, what's happened, basically. Sounds pretty intense. But what happens to all of these documents after they've, served their purpose?
That's where archiving comes in. And again, it's not just about stuffing documents in some dusty old filing cabinet. You need those secure controls to protect those records throughout their retention period.
Oh, so are we talking climate-controlled vaults and armed guards and all that?
Maybe not that extreme,
Okay.
but similar principle. You've got to protect these records from damage, loss, or, unauthorized access. These days, scanning paper records into, a secure computer system is becoming much more common. But you've still got to make sure that even those digital copies are secure.
Okay, so we've covered the why and the how of good documentation practices. But let's get down to like the nitty-gritty. What are some of those essential documents and records that you need to be GMP compliant in the pharmaceutical industry?
That's where things get really detailed. Every single document type has very specific requirements for its content. Take starting material specifications, for instance. You need a designated name, clear directions for sampling, testing, proper storage conditions, and a whole lot more. It's very specific. You can't leave any room for ambiguity.
So it's not just about like saying what something is, it's about defining like every single detail of how it's handled.
Exactly. And that level of detail, it extends to every single stage of the product lifecycle. You're talking about specifications for starting materials, packaging materials, your intermediate product, bulk product, the final product itself. Each product needs manufacturing formulas, processing instructions, packaging instructions, records for every batch produced, and regular reviews of the product's quality. And that's just the beginning. We haven't even touched on procedures and records for receiving those materials, labeling, quarantining, anything that's suspect, storage, sampling, testing.
Whoa, it is a lot to keep track of. And I imagine this is all amplified by just how many products and processes there are in a typical pharmaceutical company.
Oh, absolutely. It's vast, it's complex, but that level of detail is absolutely essential to make sure that not only are the products high quality, but the company is compliant with all those regulations. But wait, there's more. We also have what are called other quality documents, which play a key role in maintaining that overall quality system.
Yeah. Other quality documents. You've got me intrigued. What are we talking about here?
So one of the most important is the site master file. Think of it as a comprehensive overview of that entire manufacturing site, like a really detailed ID card. It showcases everything about that facility.
So it's like a snapshot of the entire operation, like from the people to the processes.
Exactly. It includes information about all the key personnel, the organizational structure, a detailed layout of the site, descriptions of all the facilities and equipment, and, of course, a list of all the products that are manufactured at that site.
So it's like painting a picture of the site's capabilities and showing how it all operates within, the regulatory framework.
Yeah, precisely. And that site master file is key when it comes to demonstrating compliance with EU GMP requirements. It's the manufacturing site's responsibility to make sure it's always accurate and up to date.
This is so fascinating. We're really starting to see that bigger picture, of how documentation underpins this whole industry. But is there a document that, goes beyond that physical site and digs a bit deeper into the quality management system itself?
There is. It's called the Quality Manual. This document outlines that entire quality management system. It describes how every single piece of the puzzle fits together to ensure quality at every level. Sometimes it can even be combined with the site master file into, a single comprehensive document.
Okay, that sounds incredibly thorough. What kind of information does the quality manual, typically contain?
It's like the blueprint for quality in that organization. It usually includes a description of the pharmaceutical quality system itself, the overarching quality policy, the scope of the system, a clear identification of all those key processes involved, and a breakdown of, management responsibilities.
I've heard a lot about quality policies. What exactly is their role in all of this?
The quality policy is a really foundational document. It's a formal statement that outlines the vision and the intent of that entire quality system. It's a commitment to quality that guides everything the company does.
So it's not just some like, feel-good statement that's hanging on a wall, right? It's an active document that drives action.
Absolutely. The quality policy has to be reviewed regularly to make sure it's still relevant, it's effective. Top management plays a critical role in ensuring the quality policy is implemented properly and that everyone in the organization understands it and sticks to it.
So it's about like fostering that culture of quality that goes beyond just ticking boxes, right?
Right. Exactly. The quality policy has to be communicated effectively at every level of the organization. It's the bedrock that everything else is built on.
This is incredible. We've gone from like a single document to this intricate web of interconnected systems. But how do you go about, actually building a system that can effectively manage all these documents?
That's where a strong, robust documentation system comes in. It needs careful design, implementation, ongoing maintenance, regular evaluations, and continuous improvements to meet all of those relevant standards. It's a living, breathing system that has to adapt to the, ever-changing needs of the industry.
So it's not just a one and done type of thing.
No, definitely not. A key aspect of a good documentation system is having a single unified system for managing all the standards within the organization. Consistency is key.
That makes perfect sense. It's all about creating that seamless flow of information.
Exactly. And within this system, you'll typically find like a hierarchical structure. At the top, you've got your foundational documents like that quality manual and the quality policy. And those cascade down into, more specific policies, detailed procedures, and ultimately those individual records capturing every single action taken.
So it's like a pyramid, right? You
Yes.
have those high-level guiding principles at the top and all the details of those daily operations kind of forming that base.
It's a great way to visualize it. And those records at the base, they are just as important as the batch of product itself. If it isn't
Hmm.
written down, it's a rumor.
I love that. It really does highlight just how important those, seemingly mundane records actually are. But with so much documentation being generated, how do companies even begin to store and retrieve all this information effectively?
Retention. It's a critical aspect of any good documentation system. Records have to be stored safely. They've got to be stored securely, usually for a defined period after, the product's expiry or certification. They can be kept on site. They can be kept off site. And as I mentioned, digital scanning and storage are, increasingly common these days.
It's incredible how much thought and effort goes into building and maintaining these systems.
Yeah.
I think it's really clear that documentation and record keeping is way more involved than most people realize. And this isn't just limited to GMP compliance, right?
That's an excellent point. While we've been focusing on GMP, a more holistic view of quality recognizes that other areas within a company, so things like human resources, finance, sales, even health and safety, can impact the quality of the products and services.
So it's all interconnected, and documentation plays a crucial role in maintaining quality across the board.
Exactly. These areas might not fall directly under GMP, but their impact on quality can be huge, and they should definitely be integrated into that overall documentation system.
This has been such a fascinating deep dive into this world. I'm already starting to appreciate just how complex and important these systems really are.
It's been my pleasure.
And before we wrap up part one, I want to give another big thanks to the London Heartbeat Z Academy for their incredible support in making this deep dive possible. If you're interested in learning more about healthcare and pharmaceutical practices, I highly recommend checking out their website and social media channels. They offer over 140 courses, and they regularly share, great content on Facebook, Instagram, Spotify, and YouTube. You won't want to miss out. We'll be back soon with part two of this deep dive into the world of documentation and record keeping.
It's really remarkable how much we rely on documentation, isn't it? Without even realizing it. Our lives are built on this foundation of documents. I mean, think about it. Birth certificates, contracts,
Yeah,
medical records, even our digital footprint these days.
it's true. We often take documentation for granted until something goes wrong, right?
Yeah.
And then we realize, oh, those records were actually pretty important.
Right. And in the pharmaceutical world, where precision and accountability are so, so important, that realization can have some pretty big consequences.
Speaking of consequences, let's shift gears for a minute and talk about what happens when documentation goes wrong. What are some of the potential pitfalls that companies face when it comes to, documentation, and what kind of impact can those mistakes actually have?
Well, the pitfalls, there are a lot of them, and the consequences can be pretty severe. One common issue is incomplete or inaccurate documentation, and this can happen for a variety of reasons. Simple human error, a lack of proper training, maybe even a culture that just doesn't prioritize, that meticulous record keeping.
So it's not always about malicious intent, right?
Yeah.
It can be more of a systemic
Well,
issue.
absolutely, and the impact can be huge. You can have batch rejections, production delays, regulatory fines, even product recalls.
Yeah.
And in some extreme cases, it can even put patients at risk.
That's a scary thought. It really underlines how important it is to get it right. But with so much emphasis on detail and precision, is there a risk of almost overdoing it? You know what I mean?
Yeah.
Can documentation become so burdensome that it actually hinders a company's operations?
That's a great question, and it's a balance that I think a lot of companies struggle with. There's definitely a risk of creating a system that is so complex and so time-consuming that it slows down all your processes and it can stifle innovation.
So how do companies find that sweet spot,
Yeah.
between thoroughness and efficiency?
It's all about finding the right tools and strategies, investing in electronic documentation systems, that can really streamline things and reduce errors. Standardizing formats and procedures can also really help make sure everything's consistent and reduce any ambiguity.
So it's about working smarter, not harder, as they say.
Exactly. And it's also about realizing that documentation isn't just this, annoying chore. It can be a really valuable tool that actually drives improvement.
Okay, let's talk about improvement then. How can companies leverage documentation to not just be compliant, but to actually um, improve their operations?
I think one powerful way is through data analysis. With the right systems in place, companies can collect and analyze data from their documentation,
Right.
identify trends, pinpoint areas for improvement, and, make more data-driven decisions.
So it's kind of like turning documentation from this static record into a source of insights.
Right.
Dynamic.
Precisely. By analyzing data from things like batch records, deviations, customer complaints, you name it, companies can identify those recurring issues, they can optimize their processes, and ultimately enhance the quality of their product.
That's fascinating. It's like turning documentation into this treasure trove of information that you could mine for, continuous improvement. But how do companies ensure the integrity of all that data?
Yeah.
We've all heard those horror stories about data breaches and data manipulation.
Data integrity is absolutely critical, and it's a major focus for all those regulatory agencies. Companies need to implement really strong security measures, things like access controls, audit trails, data backup, and recovery systems. It's also really important to have those clear procedures in place for, how you handle data, and you've got to train your employees regularly on data integrity principles.
So again, it's not just about the tech, right? It's about the culture, building that culture of data integrity within the organization.
Absolutely. Everyone has to understand how important, accurate, reliable data is, and they need to um, feel empowered to report any potential issues.
This whole conversation has been so insightful, really shedding light on all the different roles that documentation plays, in the pharmaceutical world. It's not just about compliance, it's about quality, it's about efficiency, even innovation. And it's amazing to see how technology is like transforming the way we manage and leverage all this documentation.
It's an exciting time to be in this field, and I think, we're only just getting started.
Before we move on to part three, I just want to give another shout out to London Heartbeat's Z Academy for their incredible support in making this deep dive possible. If you're enjoying this conversation, I highly recommend checking out their website and social media channels. They offer over 140 courses on a bunch of different healthcare and pharmaceutical topics, and they regularly share some really great insights on Facebook, Instagram, Spotify, and YouTube. You don't want to miss out. We'll be right back with part three of this deep dive into the world of documentation. Welcome back to the deep dive. Wow, what a journey this has been. Who knew documentation could be so complex and fascinating?
Right. It really has been an eye-opener. And like we said, we've only just scratched the surface.
Okay, well, before we wrap things up, I'd love to explore how all these principles, that we've been discussing apply beyond, the heavily regulated world of pharmaceuticals. You mentioned earlier, like HR, finance, even our personal lives, all benefit from, good documentation practices.
Oh, yeah, absolutely. Those core principles, accuracy, clarity, accessibility, integrity, they apply everywhere.
Right.
I mean, think about managing your personal finances, right?
Right.
Keeping clear records of your income, expenses, investments.
Yeah.
Not only does it help come tax season, but it lets you make informed decisions, about your money.
That's so true. I'm definitely guilty of letting receipts just pile up until it's like this mountain of paper. Maybe I need to channel my inner pharmaceutical documentation expert when it comes to my personal life.
It can make a big difference. Or think about health records. Having a well-organized system for tracking your appointments, medications, allergies, all that, it's so valuable for both you and your healthcare providers.
Especially with, healthcare becoming more and more complex these days.
Yeah.
Having all that information, easy to access can be a real lifesaver.
Exactly. And even beyond, those practical matters, documentation is really important for preserving our personal histories. Think about family photos, letters, journals. These are like the threads that kind of weave together, the story of our lives.
That's a beautiful way to put it. It's about capturing those memories, those stories, and making sure that, they're passed down.
And as technology keeps evolving, the way we document and manage information, it's going to keep changing too. Imagine AI helping us organize and analyze all our personal data or blockchain technology, ensuring the authenticity and security of, our digital records.
It's mind-boggling when you really think
Hmm.
about it. But even as we, embrace all this new technology, those basic principles, good documentation practice, they're still going to be essential.
Oh, for sure. Accuracy, clarity, accessibility, integrity. These are the things that will always underpin effective documentation. It doesn't really matter what tools or technology we use.
Well said. This has been such an eye-opening journey exploring this, often overlooked but absolutely essential aspect of, well, really of everything. Huge thanks to our expert for walking us through this fascinating world of documentation.
The pleasure was all mine. I hope everyone listening has a new appreciation for just how powerful documentation really is.
And a final thank you to London Heartbeat's Zed Academy for their amazing support in putting this deep dive together. If you're interested in learning more about all this, all things healthcare and pharmaceutical practices, be sure to check out their website and their social media. They've got over 140 courses, and they're always sharing great insights on Facebook, Instagram, Spotify, and YouTube.
Yeah, don't miss out.
Until next time, stay curious and keep those records organized.